Hello, I'm Dr. Jessica Young, an OBGYN and addiction medicine specialist. The Tennessee Initiative for Perinatal Quality Care values patient experience and understands that patient stories are foundational to our work. Hearing from people with lived experience can move us in healthcare from contemplation to action. It can help us create more effective patient-centered interventions. Spreading these stories also can help those struggling with substance use disorder feel less isolated and increase awareness that there is help available. Today, we have two people joining us on our panel. I'd like to introduce you to Alexis and Olivia. Thank you all so much for joining us today. I'd like to start out by having each of you share a little bit about yourselves.
My name's Olivia. I am 31. I have a little boy named Elijah, and I have been in recovery for 2 years.
Hello, I am Alexis and I have 4 children ranging age from 7 to 7 months. I have been in recovery for about 2 years, but working it a year.
There are lots of things that can make it hard to access care during pregnancy. This can include insurance status, transportation, childcare, fear, just to name a few things. When you were getting connected with care during pregnancy, what challenges did you have, if any?
The challenges that I had when getting connected while pregnant were really just within me. I was myself's biggest I don't necessarily want to say enemy, but I was myself's biggest downfall. You know what I mean? Like, I get everything lined up, and then the day to come into office, I would get myself hyped up about nervous because I was using that. I would either call in and reschedule or try to make it a telehealth visit. So that way I wasn't in person and I didn't have to leave a urine sample and have that in my file.
So it sounds like there was a lot of fear. What helped you overcome that?
Putting myself in front of my fear. Once I finally was like, okay, these people are here to help you. They're not here out to get you. You can do it. Just basically put one foot in front of the other and go, you know? And but then again, I was also sick and tired of being sick and tired of addiction. So I did what I knew I had to do, and that was to work my steps with Firefly.
It's gonna sound really crazy, but I didn't really just jump into getting care. I was a little nervous about what doctor to choose, all that stuff. I knew that my sister told me as soon as I got pregnant, all I'd have to do is take a test for I think it was the Lentz clinic that I went to, and I was able to get on insurance. So that was a big thing. But I mean, I guess just the thought of, I knew from day one that I was going to be a single parent with my son. So I guess it was kind of my own thing that was, I don't know. It wasn't necessarily I had a bunch of obstacles because I was actually led to where I actually went to pretty easily. It was just actually getting it started. But I guess it was the after of having a child, being in the position that I was in, that kind of freaked me out. So I guess my own mental type of situation.
Did either of you have worries about how you would be treated or perceived?
Yes, 120%. Especially whenever it came time for in the hospital, I was I was down on myself for from the very jump for being on Suboxone while being pregnant. So I feel like that's a big thing that women in my position need to realize, that what I was doing there was nothing wrong with what I was doing. I was taking care of myself in my recovery while also being mindful of of my son's side of it. But I was a little bit worried about honestly, the staff of the hospital, that sounds so like egotistical, but it was. I was a little nervous about the staff, knowing that I had a son or a child while also on Suboxone.
I thought that the people who knew that I was an addict, unless they were an addict themselves, like an active addict themselves, I felt as if they judged me or they looked down on me, or all they were going to do was say something negative about me amongst each other. So yeah, that played a really big factor. And I even had that worry like with you. So, but I'm glad I overcame that.
I think that's really common. And we, as humans, we're social animals. Like, we want to be liked. We want to be accepted. We want to be valued. And so it makes it hard for people to go into spaces where they think they might be judged or looked down on.
Right.
Absolutely.
Well, you hear the title doctor. That's all it takes for an addict to run is doctor, because that sounds so big. And I think it sounds big because you have so much more power over an addict that it makes them scared. Does that make sense?
Absolutely. The standard of care for treatment with opioid use disorder during pregnancy is medication, whether that is buprenorphine or methadone. How easy do you think it is for pregnant folks to get medications for opioid use disorder?
It was easy. It was easy for me if you reach out. I feel like that's a big thing. You also have to put in the steps to set up an appointment. I feel like there are quite a few places that I know in Nashville specifically that do help with buprenorphine. And
Did you have any challenges?
not at first. I went through a rehab though that set me up. Like I said, if I put in the steps, so it was easily connected for me. But I went through a rehab that set me up with buprenorphine.
Okay, I would say on the street, it's probably like it's a slim to nothing chance anymore. You used to be able to get Suboxone on the street, a lot more than you can now. But since this, like the fentanyl and the opioid disorder has just taken off, skyrocket, it's a lot harder to get Suboxone on the street unless you know someone who gets it. As far as like getting into a clinic and getting it, it's a lot easier than what people presume it to be. So, as long as you do what you're supposed to do, as far as like when you get the Suboxone, like making sure you stay clean or at least trying to get clean, it's not a problem. But if you're not trying at all, then of course it's going to be a lot more difficult.
Did you have any challenges that you want to share?
The only challenges for me was that because I was already pregnant when I went to get on the Suboxone, so we had to do what's called a what's it called, Dr. Young?
A low dose taper.
Yeah, a low dose taper. So the only challenge for me was actually making my mind believe that come that 7th day or like the 4th day, I think 4th or 5th day, when you're supposed to cut what you were using completely off, that was probably the hardest thing with me, of telling my mind that you're okay. But then I tricked my mind to saying, you don't need that, you need this. You need this to get you where you want to be. That is going to put you where you don't want to be, and it's going to keep you farther away from your baby. So you need this. And that is something that was new for me, having to trick my mind to being okay.
Mm-hmm.
Because my mind would always just be I'm high, or let me do this so I can get high.
Well, and that's how addiction changes our thought pathways in our brain.
Mm-hmm.
It that's the lie that addiction tells us, is that we can't
Right.
live without this. We can't go on without this. And so I think that is a really important part of recovery, is relearning
Mm-hmm.
that. And
For sure.
yeah,
Or retraining your brain.
absolutely retraining your brain. What were your main fears or concerns during pregnancy?
Honestly, being on Suboxone with the possibility of Elijah, that's my son's name, Elijah, withdrawing. That was my biggest fear. Um, and, it wasn't until afterwards I really didn't realize this is a fear of mine, but my breast milk didn't come through. So that was a big fear during postpartum. That I know it says during pregnancy, but that was a big fear for mine, because, like, how am I supposed to help? You know what I mean? Because that's one way to give to, anyways.
Mm-hmm.
That was a fear for me as well. But I actually did not have Elijah. He was fine. He didn't have any withdrawal. I know that's not for every single baby that is born. But with my experience, there was no issue with it.
My main fear and or concern during pregnancy was that my baby was going to be born addicted, or we were going to have a longer stay in the hospital, or DCS was going to try and take my baby. That was literally like my only real main concern once I got past the addiction part. But in the beginning, I wasn't sure how I was going to be able to fight the actual addiction part to get over that. So that's probably really my only main concern.
A lot of people say that and experience that the fear around DCS involvement is something that keeps them from treatment in the first place, or even if they're in treatment, gives them a lot of stress and anxiety during pregnancy. Are there things that could help with that?
My daughter, my 2-year-old, it felt as if she was working with me.
Mm.
And the DCS worker with my last daughter, it felt as if she was working with me. Like we were standing side by side. And it wasn't more so of, oh, I'm trying to take your baby, like with my boys was. It was, no, let me help you keep your baby. And that made it a lot easier.
Absolutely. Makes all the difference,
Mhm.
really. Thinking back to other pregnancies, were there things that you wished you had during those?
Yes, Firefly.
Mm.
Firefly. I wish I would have stumbled across Firefly way sooner.
What do you think about that program has helped you the most?
The connections with people, the doctors. It's nice, you don't feel like an outsider. You feel like a whole, like a family. And that's what it needs. That's what you need to have a successful recovery.
What supports did you wish you had after delivery? And that could be now currently or with your other kids.
And the outlets that I know that I have support, God, my program, Firefly had been a big, like, what we talked about earlier, Firefly had been a big part of it as well. So I feel like I was surrounded by support, if that, I was kind of lucky in that sense. I was very lucky in that sense.
Maybe more of like easier to get childcare. Because it's really hard to be able to get help with childcare, like daycare and stuff like that.
Absolutely. It's a big barrier.
Yes. Like it keeps you without a job, because in order to get childcare from the state, you have to work so many hours. Well, how do you expect me to work so many hours if I don't have childcare in the first place? So that's
a cycle.
Yes, it's a vicious cycle, and that's been something that I've been dealing with lately.
What tools or supports have been the most helpful to you overall?
My sister has definitely been a very, very, very big support for me, and has stepped up in many different ways. I also have my meetings that I go to that's been a really big support, that has been helpful to me as well.
Are there any supports, whether that be medical, anything that you were provided through insurance?
Oh, yeah.
Anything like that that helped?
Yeah, actually, insurance got me a breast pump. And when I could, I was using it. I know, like, with Firefly, I have my recovery coach. I kind of had two different ones, but either way, like, both of them still were very, very prominent in my life. With insurance alone, like, I went through looking. I'm just side note, like, I went through looking at other insurances and prices the other day. That right there was like, it's very expensive, and I was very fortunate for what I got with my insurance with TennCare.
I'd like to ask you a little more about peer recovery specialists.
Okay.
What is so helpful about working with a peer recovery specialist?
For me, it was because, first off, this is somebody that I connected with both inside and outside the office. We were able to keep in contact weekly. I had groups that I went to. I also knew that this person walked, if obviously not the same, because we're not the same people, but they walked a very similar path that I did, and have been able to see the other side of things. So whenever I was able, if something was going on and I was craving, or whatever it may be, I could reach out to them, and they knew. They're like, yeah, I know this time that this happened with me, and this is what I did. But they're also able to connect that bridge between you and your doctor, because I feel like, I'm gonna be honest with you, it was kind of weird for me at first. Like, I felt bad in the beginning for taking Suboxone during pregnancy. For me to sit there and talk with my doctor about that, that was uncomfortable, because it's just like, you know what I mean? They were able to bridge a gap between me and the medical side of it, and for me personally, that really helped. So I don't know. I got very, very lucky with my recovery specialist. I did.
And what you've described is what we see on a large scale level, with peer recovery specialists, recovery coaches being put into traditional medical settings, whether that's hospitals or rehab facilities, and how the important work that we see that's happening with keeping people engaged and feeling supported.
Right. I liked seeing them in the medical sense, like, I really did. And I feel like it would be beneficial, especially working with people in recovery, not just with pregnancies either. Like, I feel like a lot of places could have some type of recovery specialist, of maybe not,
My peer support coaches, and the feeling of knowing that if I need anyone in that office, whether it be Dr. Young or whether it be the nurses or just anyone, that I can reach them at any time of the day. It does not matter. They're always there. They're always in my corner, and they will be in my corner. So that's nice. That's a really big relief. And the coaches are the same way. I join meetings with them, and that really helps get that, like, one-on-one ordeal. Even though it's not with, like, my assigned peer support coach, I still get that one-on-one with a different support coach. So that feels good too, because then that gives you, like, a connection or a pull with them as well. So that's nice.
A whole group of people.
Yeah.
Have your back.
Got a family.
Overdose is the highest cause of maternal death in Tennessee, and most of those deaths happen in the year postpartum. What supports do women with substance use disorder need postpartum to prevent relapse and overdose?
For me, the supports that I needed that have helped me in postpartum, like I said earlier, this is not, from a medical standpoint, but my sister, she was with me there the entire time. Literally from the time I had him, actually really from the time I got pregnant, and then onward with Elijah, she's been there. That has been my biggest support, because on days where I didn't feel like getting out of bed, she was in there like, hey, let's go to a meeting. Hey, let's do a Zoom. Hey, what can I help you with the baby? You know what I mean? She kept me connected, which is my second support, was staying connected, with my meetings, with my doctor. And I was honest, it takes a part of yourself as well for you to reach out for that support. With my depression, I said, hey, I need to get back on my depressive medicine. But I also had that recovery specialist, checking in on me, and texting me each week, hey, can I help you with anything? Hey, do you need diapers? Hey, do you need anything? It was good.
For a lot of people, connection is often what they feel like is a very protective factor.
Yes.
for their recovery.
Okay, when you're coming out of having a baby, you're really, really vulnerable and you don't even realize it, but you are. So making sure that like you have a structured environment for you and baby is really important, because there's no way you can have a baby and that feeling that you're not 2 anymore, you're back to 1, and then you go around your old crowd. There's no way that you won't relapse. So you really have to cut your circle small. Go from 15 to 3. And that's normally family. So as far as the relapse prevention thing would go, probably just making sure that, people of support stay connected, stay reaching out. Instead of just reaching out by phone, go to them, check up on them, give it a more physical one-on-one than just a, hey, how are you? I'm just texting you to see how you are. Be a little bit more involved in those vulnerable time periods, and maybe see where that would get us.
I really appreciated what you said about postpartum women in that time frame being more vulnerable than they often realize to relapse. And I think that's very true.
Mm-hmm.
How much do people in general know about preventing overdose?
Obviously, we know that fentanyl and the opiate epidemic is huge, on TV and news and all that stuff. You hear about it everywhere. You read about it everywhere. But actually, how easy it is to get Narcan, and to know, like, I know a lot of people don't know how to issue it to somebody, for instance. But if you know where to look, it's easy access to.
If you're an addict, that's like that saying, if you know, you know. But if you're not an addict, I can't say that there's enough education pamphlets or pop-ups, going on, because it is very serious and it is something that everyone needs to be aware of. And honestly, because if you don't have the opioid in your system, Narcan's useless. So everyone should have Narcan with them, because you never know. And I do feel like this is something that everyone needs to be well educated for. And even the generation coming like out of high school, the young adults need to know about it as well and be educated.
Do you think people know
where or how to get Narcan/naloxone?
At pharmacies, some pharmacies on the counter, when you walk up to pick up your medicine, they'll have a thing where you can buy Narcan for $25.
Do you think a lot of people are buying Narcan for $25?
No. Who's going to buy Narcan for $25? You know? It's not for them. Why do they need to spend $25 on Narcan? That's what I'm saying. Narcan shouldn't cost us, especially with the opioid crisis the way it
Amen.
is.
Do people know about fentanyl test strips?
I didn't even know about fentanyl test strips. The only way that I knew about that is like from police officers.
Mm.
That's the only thing. That's just drug test strips. I didn't know we had access to that.
That's something that a law was passed in 2022 that legalized fentanyl test strips in Tennessee. And so the Tennessee Department of Mental Health and Substance Abuse Services has started distributing them.
Well, it's kind of a hit and miss. Some people do, some people don't. I personally didn't know about them until a friend of mine was like, let me test something. And I was like, okay, just to make sure, just to see if that's what it is or if it's something else. And I was like, okay, you know. But I didn't know about them until then. Like, I didn't know that you could get them. I honestly asked them if they got them off the black market because I didn't know, you know. But they were like, no, got them on Amazon. And I was like, okay, you know. So, yeah, I'm sure a lot of people don't know about it.
What advice would you give to someone who is pregnant and using substances?
My advice would obviously be to get clean, but you can't really just tell somebody that, you know. I've always heard that addiction is stronger than a mother's love even. I would say get connected. That would be go to a meeting and make a choice. That would be my advice to them. And then, you know, based on that choice that they make, possibly giving them resources. That's my first go-to is like anybody, I think I've told you this before, but anybody that I know that's pregnant is on Suboxone, I tell them about what I've done, what you know, what program I've gone through, and how much it has helped me. So that's what I would say.
The same advice that I gave to a really close friend of mine. The Firefly Clinic is always accepting new patients. When you're ready, let me know, and I'll give you the number. But it's never too late. And you'll love it. They're great.
If you had a magic wand and could make one change that would be helpful to all pregnant women with substance use disorder, what would that change be?
Not feeling like condemned. Does that make sense? Like
Absolutely.
not feeling like that's what I would do. Because I mean, like it's hard to admit like, hey, I'm using heroin, but I'm also pregnant. It's a hard thing to admit to somebody and not feel like you're going to be, you know what I mean? Just the peace of mind to know that they're not alone and there is another side to it.
Probably to lighten the load a little bit when it comes to the worrying about DCS and stuff like that. That would be some, because I know that was really big for me. So, and I'm sure that's really big for others. So if I could just lighten that just a little bit, make their life just a little bit less hectic and stressful, I feel like that would really help.
So less fear.
Mm-hmm. Make DCS not so scary because of the name.
So maybe if our systems could be more supportive and less punitive or feel like a punishment, that might be helpful.
Right. And, you know, that's exactly how it feels. Like a big punishment that you never come out of. Even once the case is over, because the damage is done. And it will always be something traumatic. At least for me.
Is there anything that you would like to add to the conversation that I didn't ask about?
Just that I think I'm going to reiterate the recovery specialist thing. I'm telling you guys, that has helped me so much with like the two people that are in my life. One is not there and she still reaches out to me on a regular basis. Like you do not find that in places. Like I call them my God winks. I genuinely feel like God showed up in my life whenever I was brought to where I was, which is, Firefly at Vanderbilt.
Just to really, let mothers or expecting mothers know that you can do it no matter what they say. They might tell you can't, but you can, and you will. From one struggling addict mother to another, I love you, you're strong, and you got this. Keep pushing.
Thank you both so much for sharing your experience and your time. I know your stories will resonate with the healthcare professionals and community members that watch this video.